The SARS coronavirus has this, what we're calling SARS-2, has some similarities to the first SARS coronavirus back in 2003, and that it causes a serious respiratory infection that looks like a pneumonia that's accompanied by a lot of a big inflammatory response. So that we know is similar, but there are also some concerning differences as well. One of them is the fact that there seems to be a fair bit of cardiac disease, heart disease in patients. So we're hearing reports initially that came out of China and now being reproduced in Europe and the United States of what some are calling acute heart injury. And if that sounds vague, I think it's because we don't really understand what's happening at this point, whether people are having heart attacks, myocardial infarction, or whether the virus is actually invading the heart tissue to cause inflammation, what we would call a myocarditis. And then we have the other big concern about the fact that many people are asymptomatic with this condition, meaning they have no symptoms or low-grade symptoms. And the numbers suggest as many as 18 to 50% of patients may be without symptoms. And this is what makes the virus so complicated in terms of controlling, because you have one group of patients that's getting very sick and in the intensive care unit. In some cases, we know the features of those individuals, to older individuals, those with underlying diabetes and heart disease, hypertension, renal disease, and then a subset of individuals who seem to be handle the virus very well and are with minimal or low grade or even no symptoms at all and have the ability to transmit the virus. So you get yourself in this difficult situation where you have a group of very sick individuals, yet a group that are well and transmitting the virus in the community. So it's really a bit of a nightmare scenario for that reason, high level of transmissibility and yet a group of patients getting very seriously ill. Right now, what we're seeing is COVID-19 has reached a peak in the United States this spring. We've had over 500,000 cases that we know about, at least 20,000 deaths, but because of the under-testing, probably the numbers the true numbers of the number of cases are probably far higher. You know, we don't really have a good sense of the total number of cases right now in the United States. Some say that for every death, there might be 1,000 cases. So if that's true, then we're probably looking around 20 million cases in the United States. It's still a minority, but a substantial number. So this is clearly a huge epidemic underway. And I think an important question is, what does it look like now for the next few weeks in the United States? The peak on the northeastern part of the United States, New York, New Jersey, seems to be happening about now. We expect the peak to proceed around May 1st in Texas in the southern part of the United States. And then a big unknown is, can we maintain the social distancing for the next few weeks in order to bottom things out so that by the middle of May, maybe going into June, we'll have reached a nadir, the lowest point in our epidemic. So that's one of the really important and unknown features is, can we aggressively pursue social distancing over the next few weeks? We don't really know what's going to happen over the coming months or years with the virus, and this is why models are extremely helpful. But of course, they're only as good as the assumptions that we put into them. But one of the unknowns is, assuming that we can relax social distancing and over the summer, what do the out months and years look like? And my colleague, Mark Lipsitch, who's at Harvard, has recently published a fairly intensive investigation modeling exercise where they think this virus could return on a seasonal basis in the coming years once this virus establishes in the community, meaning that every winter, similar to influenza in the Northern Hemisphere, we could see peaks in January, February, and March. And if that's the case, we're going, Americans are going to have to be very mindful of this and recognize that even if we begin relaxing social distancing and transmission diminishes, that it could come back in these periodic waves as suggested by the model. And this, we then may have to implement social distancing at that point later on. So I think this is going to be really important for us to have some situational awareness and recognize that this virus could come back in periodic events.